My name is Dustin Soriano. I decided to do some research and do my paper on mental health care within the United States. The topics being covered here are going to be the problem and its origin within the United States, the effects of the political and the bureaucratic power on mental health and administrative law, the ethical behaviors and concerns regarding mental health care, federal concerns with mental health care, and mental health within policy. So to begin with the origins of mental health, they date back sometime, even all the way back to the Egyptians who were researching mental health. The Greek philosopher Hippocrates, he was who was alive and practicing around 400 BC. He introduced what was called disturbed psychology, which would actually later become mental illness or be known as mental illness. So he was even studying it back then. The gentleman on the bottom in the middle, Clifford Beers, he originally founded the Mental Health America in 1909. His intent was to assist the mentally ill by improving their lives through the efforts of research and lobbying. As well, just to clarify that mental disorders, they affect, they're anything that affects somebody's mood or behavior. Examples are anxiety disorders, depression, eating disorders, addictive behaviors, and schizophrenia. Moving on, the effects of the political and the bureaucratic power on mental health. First of all, we live in the wealthiest country of the world. In 2005, it was estimated that 40 million people were without the most basic health insurance coverage here in the U.S. Public health care programs and the public health care programs that benefit the indigent and poor are chronically underfunded, and the powerful insurance interests and private healthcare industry continually work to block or diminish all efforts for any sort of progressive healthcare reform. Someone who helped really simplify the understandings of the capitalist belief or the capitalist society within mental health was Michael Foucault, which is a gentleman there on the right. He broke it down into three components. Their economic power, political institutional power, and ideological or discursive power. The economic power is motivated by profit margins in the economy. The access and control to money and other resources determine the decisions made by political and bureaucratic figures. This basically leaves the wealthy with great mental health care and the poor with little or no mental health care. The second, the political institutional power. Under capitalism, the mental health system is controlled and operated by a multitude of organizations and institutions that have been dominated by the majority elite administrators, doctors, and experts, especially about 40 years ago when the mental health care suffered decentralization. It was pretty tragic for them. The third, the ideological or discursive power, is capitalists consider mental health and illness to be, biological medical models that basically treat forms of mental illness as pathologies. The capitalists often blame those whom are mentally ill as acting outside of the social normative behavior and often ignore the social, economic, and political causes. So mental health and administrative law. As time has passed, the most recent years, the new administrative laws have been approved and utilized by the politicians in the United States. Some of the regulations have been implemented by states themselves and some by the federal government. There's some big ones here. A plan recently implemented called the Paul Wellstone and Pete Domenici Mental Health Parity and Addiction Equity Act. It's got four fairly major issues with it. The issues that it was trying to solve were that the plan ensures that deductibles and copays, as well as visit limitations, aren't restricted for mental health patients. The parity also extends to intensive outpatient facilities and residential institutions that provide intermediate levels of care. The Act creates a transparency required for the health plans and its participants in order to maintain compliance with the law, and the provisions that allow the insurance companies to make exceptions to the parity requirements for certain plans were also eliminated, which gets rid of many of the loopholes that insurance companies were getting in and out of. As well, the Affordable Care Act, which was passed in 2010, made great strides for mental health in its entirety, as even healthcare in general within the states, and we'll talk about that later. Ethical behavior, ethical concerns. There's critical issues and inequalities throughout the world in regards to mental health. It's often overlooked. There's an estimated 30% of the global population has some form of mental health disorder, and 2/3 of this 30% do not receive appropriate care that they require, which in conjunction may lead to the mentally ill into alcoholism, drug abuse. Here in the States ourselves, there's 57 million adults that suffer from some form of mental health disorder, and annually, and about 1 in every 17 of these people has a serious mental illness. It's estimated that by the year 2020, mental health globally will be about 15%. That estimate is higher than AIDS, traffic accidents, and heart disease combined. So, I mean, more people will be mentally ill than all three of those things. Despite the overwhelming evidence, the ethical concerns in regards to mental health and illness, again, is not to be underestimated. The socioeconomic relationship puts many of the poorer citizens at higher risk for mental illness. There's always there's consistently been a lack of political effort and advocacy in regards to proper medical care and treatment for the mentally ill. They've set a stigma and kind of discriminated towards the mentally ill, which has led to unethical practices, improper funding. People and organizations that help and treat these mentally ill individuals, they also have come under scrutiny. Another ethical behavior, of course, goes back to capitalism. The United States estimates that about $79 billion have been lost because of mental illness. About $63 billion of the $79 billion have been lost due to lack of productivity, because the mentally ill, of course, are at higher risk for institutionalization, and they're unable to engage in regular work activities, let alone some social activities as well. So the federal concerns, the MHA has strongly urged the federal government to continue in their leading role in the recovery-oriented mental health and substance abuse services and the development of evidence-based research throughout the United States. The collapse of the community's mental health system throughout the country allowed the federal government the ability to transform the mental health system in order to better suit the consumers and affected families. They've really taken some great strides, and they've taken a great leading role. Again, with the passing of the Affordable Care Act, the federal government outlined the benefit of mental health services. So they're alone, they finally seem to have caught on, and they're starting to assist more. They're also trying to assist the military community, which an estimated 20% of vets suffer from PTSD, and another 20 have traumatic brain injuries. So mental health within policy. When mental health policies are clearly conceptualized, activities and essential services can be coordinated in order to ensure that these services are rendered appropriately without suffering the inefficiencies and fragmentation within the rest of the health system. Mental health plans are detailed objectives that are highlights and must be accomplished in order to have a successful mental health policy. There's three big ones that have gone on in the past quite a few years, going back 100 more years. The State Care Act, which has existed since 1890. It's the care of people with severe and debilitating mental illness. They were transferred to the state. Many of these mentally ill patients were housed in state asylums and facilities that were funded by local governments and money. Another one is a joint commission. The American Medical Association and the American Psychiatric Association created the Joint Commission in 1955, which consisted of a panel of commissioners whom would vote on certain mental health matters, including appropriate funding and activities. Although they had many disagreements between themselves, they were able to benefit the mentally ill by catching the eye and funding of the federal government, whom then extended the Joint Commission support policy from state institutions to community mental health centers. So this was they made a great win. And of course, probably the most prevalent and most well-known right now is the Affordable Care Act of 2012, which was signed by Obama on March 23rd of 2010. 2010. This act revolutionized both mental health and health care in general within the U.S. Healthcare information was now more attainable because it was readily online for consumers. It prohibited insurance companies from denying people benefits of health insurance or relinquishing their insurance due to newly found or pre-existing medical conditions. Lifetime health insurance limitations were made illegal. Small business and individuals were able to obtain health insurance because it was much more affordable. It's just been a substantially beneficial policy to all healthcare in general. To conclude my paper, my PowerPoint here, I mean, new laws and regulations, policies, they're coming in and out of play within the government. Mental health appears to be taking up some of the spotlight and gaining support from political figures and parties. It's been increasing in discussions and importance. Policies such as the Affordable Care Act of 2010 really go to show, how important how highly the politicians are taking mental health into consideration. I mean, and this Affordable Care Act, I'm sure, will continue to be modified, adjusted, reinvented within future years to come. So thank you for tuning into my presentation. And that's it. We conclude here.